She had delivered 417 babies before she delivered her own. Saoirse Brennan had been a midwife for 6 years. She had worked in a busy maternity unit in Dublin, and then in the community practice in Asheville, North Carolina. And she had the particular professional competence of someone who had seen enough births to know that the expected and the unexpected arrived in equal measure, and that her job was to read the difference. She was good at her job. Her colleagues said this. Her patients said this. She said it herself, with the specific confidence of someone who had earned it. She had missed something with her own son. Declan was born at 38 weeks, which was early enough to require monitoring, but not early enough to raise the specific alarms that premature care activated. He was 5 pounds, 14 ounces. He latched well initially. His color was good in the delivery room. At home, 3 days later, he began to tire during feeds. Not dramatically, not the feeding refusal that would have sent a midwife's alarm bells ringing, just a gradual slowing of his suck pattern, a mild gray-blue undertone to his lips that appeared when he had been feeding for more than 10 minutes, a slight breathlessness that she told herself was nasal congestion from the birth. Summit was an 18-month-old Bernese mountain dog who had come to them from a breeder in Hendersonville when Saoirse was 6 months pregnant. He was large, even for the breed, 98 pounds, the tri-color pattern of black and white, with the warm rust-brown markings. And he had been introduced to Declan at the hospital with the careful protocol the books recommended. He had sniffed the receiving blanket. He had met them at the front door. He had established himself within 24 hours of Declan's homecoming as a floor-level presence during every feeding. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. He did not interrupt the feedings. He positioned himself beside the nursing chair. He watched. On the 4th day, he pressed his nose against Declan's chest. Saoirse moved him. He repositioned himself and pressed again. Not intrusively, not with force. The specific careful pressure of an animal aware of its own size. She felt the large muzzle against her arm. She looked down. Summit's eyes were on Declan's face. She told herself he was being protective. She had read about this, the Bernese mountain dog's strong guardian instinct, activated by the arrival of a new family member. She logged it as breed behavior and adjusted the feeding position. On day 6, during the afternoon feed, she noticed the color at Declan's lips shift to a definite dusky tone. At the 11-minute mark, she was a midwife. She knew that toddlers had exaggerated skin tone responses that were not always clinically significant. She knew that transient cyanosis in newborns could be peripheral, positional, benign. She also knew that when something about a patient's color made you look twice, you did not tell yourself you had looked once, and it was fine. Summit was standing beside the nursing chair. He had moved from his floor position to a standing position. He was looking at Declan's face with the focused stillness she had noticed on day 4. She called the pediatric assessment line. She described the feeding pattern and the color. The nurse asked her to come in. "Has your dog ever done something you couldn't explain until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard." The pediatric cardiologist was a woman named Dr. Fatima Idris, 14 years in pediatric cardiology, with the specific manner of a physician who had chosen a specialty that required you to be right and to be calm at the same time, simultaneously. She reviewed the echocardiogram. She was quiet for a period that Saoirse, as a professional, recognized as the period in which a clinician was formulating how to deliver information that was not good news, but was not catastrophic. Declan had a patent ductus arteriosus, a connection between 2 major blood vessels that should have closed at birth and had not. It was causing a significant left-to-right shunt. His heart was compensating. The compensation was what was causing the fatigue and the color change during feeds. His system could manage at rest, but not under the circulatory demand of sustained feeding. It was correctable. The procedure was standard. The window for intervention was not unlimited. but they were well within it. How long have you noticed the symptoms? Dr. Idris asked. Saoirse said since day 3. Dr. Idris reviewed her notes. And you brought him in today. What made you come in today? She thought about the dusky color on day 6. She thought about day 4, day 5. She thought about the large black and rust dog standing beside the nursing chair, pressing his muzzle against her arm when she shifted position, she said. The dog. Dr. Idris looked up from the chart. She explained. Summit. The positioning, the consistency, present for every feed, not 1 or 2. The nose pressed to the chest on day 4. The standing on day 6 when the color had shifted. Dr. Idris was quiet for a moment. She was not a person who dismissed things quickly. Bernese mountain dogs have one of the highest heart rate sensitivities documented in working breeds. She said, there's not extensive formal research on this in cardiology, but informally, and I've been in this field for 14 years. The number of times a family comes to me and says the dog was acting differently is not 0. She looked at Declan, who was sleeping in the examination bassinet, chest rising and falling with the work he had been doing since day 1. That dog heard something. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. The procedure was scheduled for the following week. It went without complication. They were home on Thursday. Summit met them at the door. He followed Saoirse to the nursing chair for the evening feed. He positioned himself beside it, the way he always did. This time, at the 11-minute mark, there was no color change. Declan fed to the end of his appetite and fell asleep with the complete limpness of an infant whose body was not working too hard to survive. Summit lay down beside the chair. He put his chin on his paws. Saoirse had attended 417 births. She had seen the full range of what a human body could do, from the ordinary to the remarkable. She had missed the particular thing that was wrong with her own son's heart. The dog had not missed it. She sat in the chair in the quiet house and did not say anything because she was a professional, and she knew that some things did not benefit from being spoken. And because Declan was sleeping against her chest and Summit was on the floor beside them, and the room was full of the particular peace that comes after a long time of being afraid. The next story is about an animal who tried to tell a family something for 9 days before they understood the warning. Subscribe so you're there when it posts.